The recent report from the Transcultural Psychosocial Organization and United Nations High Commission for Refugees in Uganda show that there is a decline in the surge of attempted and suicidal cases in Rwamwanja refugee settlement camp located in Nkoma, Katalieva sub-county in Kamwenge district. In 2021, the attempted cases stood at 59 and 11 deaths were registered. In 2022, 41 were attempted suicide cases, 12 were death cases. 30 attempted suicide cases were registered in 2023. 6 were deaths registered, and from January this year to date, 32 attempted suicide cases have been registered, with 7 deaths inclusive of children. The report indicates that female refugees are the most affected by attempted suicides, while males are most likely to die by suicide. This is triggered by family disagreements, domestic violence, amongst other triggers.
People talk about suicide before they actually do it. So a person can come and say, Florence, I think death is better. Such a person has to be treated very importantly, and you reach out to them to see that you support them to overcome the challenge they are going through.
The decline in the number of suicidal cases in Rwamwanja refugee settlement is due to treatment rendered to victims by Transcultural Psychosocial Organization with the help from the United Nations High Commission for Refugees. Here, they are undertaken through mental health and psychosocial interventions like cognitive therapy, problem management plus, among other interventions. However, the mental therapy is challenged with lack of basic needs, depression, limited personnel to handle the patients, lack of enough medicine, amongst other challenges.
Some are unsolvable, but like the poverty nature of someone. You cannot say I'm going to change the lifestyle of this person by providing all what she needs.
Mental conditions are not conditions that probably you will treat for 1 week. Some of them have to go on lifelong medication, okay? 6 months, 1 year, okay? So our biggest challenge sometimes we are having here has been in terms of supplies, okay, in medication.
The suicide survivors who overbeat mental health problems recall the tales.
I wanted to end my life because I couldn't stand my father's violence against my mother. He almost strangled my mother to death.
The suffering I caused to my family almost took my son's life and my own. Whenever my wife helped to fight my post-war trauma, I instead turned violent.
The tragic scenes from the wars in Congo caused inner damage to me. Life became so hard in Uganda, and whenever I thought of how my property perished, I felt like committing suicide.
Another therapy used to overcome suicidal cases is community engagement, where members share their challenges and get solutions from their fellows. In these community engagements, they have been able to set up projects like cereal gardens, goat rearing, among others. With the skills and knowledge attained from a training conducted by TPO Uganda and UNHCR, teachers at Rwamwanja Inclusive Primary School have been able to overcome the mental health challenges affecting the learners.
Of the class, you find the learners hiding behind the class under the tree, sleeping. You try to engage the learner is not responding.
Now they are well, they can enter class without force. They focus you.
To overcome suicidal tendencies in the camp, development partners and government ought to wear out the triggers.
And many times we also try to link this to livelihood opportunities, because what stresses us sometimes the underlying causes may be also a sense of sense of survival.
As TPO and other partners are looking at giving psychosocial support, counseling and all that, the focus is on addressing the triggers. How do we address the causes of gender-based violence? How do we address the challenges related to food insecurity?
In a day, around 106 refugee patients flock Rwamwanja Health Center for. Out of these, 30% have mental illness. However, the hospital is challenged with limited access to treatment due to limited funding.
The medicines we have as the credit line are very few, so when we receive them, these medicines can be consumed because of the high population within 2 weeks.
As of late, Rwamwanja Refugee Settlement Camp holds a total of 99,518 refugees. 98% of them are Congolese nationals. The rest are Rwandan, Burundians and South Sudanese. Despite being in a refugee camp, their birth rate is high. In a year, 400 babies are born, something that worries both the caregivers and the host communities. Becca Senyonga Mulinde, NTV Weekend Edition.